In this video, I will talk about the foods you must eat every day if you have kidney disease and want to improve your health. Just 10 years ago, everyone knew that kidney disease was irreversible. When you were diagnosed, your doctor would immediately book you an appointment at a nearby dialysis clinic. However, today, kidney disease no longer seems to be irreversible. Even patients in stage 5 have a chance to see improvement. How is this possible, you may ask? Have they discovered better diagnostic tests, new pharmacological treatments, or stem cells? The most important change has actually been diet. With a proper diet, patients at all stages of kidney disease have a chance to improve or at least slow down the progression of the disease. But your diet needs to be personalized. As the saying goes, one size fits all may apply to cheap clothing, but not to your diet. That's why today, I want to show you the foods you must eat every day, depending on your own needs. There are many foods that benefit kidney health, but you cannot eat all of them every day. On the other hand, most CKD patients also have complications or comorbid conditions they need to manage, such as diabetes, high blood pressure, proteinuria, anemia, or heart problems. There are certain foods that are not only good for CKD but also very beneficial for one or more of these conditions. Here are 5 foods you must eat every day if your goal is improvement. Alright, let's get started now. I have a lot of foods to share with you today. Let's begin with the foods that will help with diabetes. If you have diabetes and CKD, you should follow a plant-based diet. That is the only way to improve. You will want to eat plenty of fruits and vegetables and avoid meat and animal-based foods in general, as well as added sugars. Remember that the only way to improve with diabetes is to consume fewer calories than you burn. The keto diet, the carnivore diet, and any other diet only work because they put you in a calorie deficit. But you can achieve that with a diet that does not destroy your kidneys in the process. To prove this, let's look at some foods that diabetic patients must eat, starting with oats. Rolled oats are extremely beneficial for people with diabetes. They can actually improve your insulin sensitivity. This is a proven fact. A review of 16 studies conducted on hundreds of diabetic patients concluded that oat consumption improved glucose levels, insulin sensitivity, and lipid profiles. Consume rolled oats every day, of course, without added sugar. If you have diabetes, you can eat them with some berries and a teaspoon of cinnamon on top. Another food I highly recommend is tangerines, especially with their peel. Why tangerines? Recently, a case report was published in the BMJ about a CKD patient with diabetes who was rapidly progressing to stage 5. He started a new diet, a plant-based diet, and immediately began losing weight. They had to reduce his insulin dose after just 2 days. Yes, the power of avoiding meat. An interesting fact about his diet: he doesn't follow many rules besides avoiding anything that isn't plant-based. His only strict rule is to eat 2 small citrus fruits every day. Why citrus fruits? Because they contain bioflavonoids that improve insulin sensitivity. So, eat mandarins daily, peel included, since that's where the bioflavonoids are. You can add them to smoothies. For diabetes, also eat okra, also known as lady's fingers. This is a staple in southern U.S. cuisine with many benefits for diabetes. It contains a special type of fiber that slows down sugar absorption in the digestive tract, leading to a more stable blood sugar response. This is one of the rare foods that can actually lower your fasting glucose levels just by adding it to your diet. It has an extremely powerful effect, as review studies indicate. So, Add okra to your diet if you have diabetes. Alright, let me know in the comments if you want to see more foods for diabetes. I can make a new video about this. Also, don't forget to subscribe and hit the like button if you haven't already. Next, what food should you eat daily for high blood pressure? High blood pressure, or hypertension, is the bane of CKD, chronic kidney disease, patients. It's a condition caused by kidney disease that, in turn, harms the kidneys. Plus, the medications used to treat it also damage the kidneys. This is why you should follow a specific diet for high blood pressure. How do you do that? First, avoid consuming too much sodium, which mostly comes from processed and packaged foods. Also, make sure to avoid animal products and anything with added sugar. Some people are also sensitive to caffeine. Last but not least, always stay properly hydrated. But what about specific foods? If you have high blood pressure, one thing to consider is consuming a smoothie with beets and spinach every day. You can also add them to soups or eat them in any way you prefer. It doesn't matter how you eat them, just find a way to include beets and spinach in your diet. Why? Because of nitric oxide. Many CKD patients have dangerously low nitric oxide levels, which is bad. Nitric oxide is a powerful vasodilator. It not only lowers blood pressure but also increases blood flow, oxygen, and nutrients to the kidneys. So, what you want to do is eat more nitrate-rich foods like beets and spinach. These are some of the best nitrate sources available. Here's another extremely healthy food for people with high blood pressure: cacao powder, the purest form of chocolate you can find. This is actually the seed of Theobroma cacao. It's where cacao solids and cacao butter come from, and it's incredibly healthy because it contains all the benefits of cacao without any additives. It's packed with flavonoids and antioxidants that protect the kidneys. In clinical trials, subjects who consumed natural cacao experienced a blood pressure reduction of 3.7/2.7 compared to the control group. I mean, this is amazing. This is just food, not medicine. And of course, you can also get this benefit from cacao beans or other natural cacao products that contain no sugar or additives like phosphorus. Now, cacao and other foods for blood pressure are slightly high in potassium, but this shouldn't worry you. In fact, when CKD patients were given 40 grams of dark chocolate daily in a trial, their plasma phosphorus and potassium levels did not change. The only thing that changed was the level of inflammatory markers, showing significant improvement. This is why everyone should consider cacao, not just those with high blood pressure. One superfood that every kidney patient must have in their diet is garlic. Garlic is something I often recommend for high blood pressure, but it has countless health benefits. It also helps with diabetes, cholesterol, heart health, liver health, the immune system, heavy metal detoxification, and bone health. Studies also show that it protects against Alzheimer's disease and helps you live longer. Yes, I have recommended garlic millions of times in my videos for many good reasons. Eat garlic every day. Now, let's talk about a condition that can make a difference between improving kidney disease and kidney failure: proteinuria. So, what is proteinuria? This is often one of the first things doctors look at when you get a blood test. Proteinuria, or the presence of protein in the urine, not only tells you how well your kidneys are functioning right now, this level actually predicts your future. Yes, the higher your proteinuria level, the faster your kidney function declines. If we don't want that, there are a few things everyone should do to fight proteinuria, including ensuring vitamin D levels are checked and supplementing with omega-3. Yes, and of course, a low-protein diet. There are also certain foods you must eat every day if you have proteinuria. The first is turmeric. Like garlic, turmeric is something I always recommend. Eat it every day, especially if you have proteinuria. Why? Because it is one of the most powerful superfoods on Earth. It has numerous benefits, and most importantly, medical literature has shown that consuming this food daily or taking curcumin supplements can significantly improve your proteinuria levels. Now, you know that I am a natural therapist, and the way we use turmeric is as part of, for example, herbal teas and formulations. Yes, to make it more effective, turmeric is often used in combination with other herbs. The most important thing you should combine turmeric with is black pepper. Turmeric doesn't work without it. But today's video is not about distractions, it's entirely about the foods you can eat. Turmeric can be delicious, and another incredibly healthy food you can add to turmeric is ginger. In my opinion, ginger is a must-have in any kidney-friendly diet, and if you also have proteinuria, make sure to eat it every day. You can use it with turmeric, for example, by preparing a golden milk drink. I love this thick, delicious drink made from powdered spices, including turmeric, black pepper, ginger, chili, and cinnamon. But don't use regular milk or butter to make it. Instead, use soy milk or almond milk and a spoonful of olive oil, then add ginger. Recent research links ginger to numerous health benefits, primarily due to its powerful anti-inflammatory effects. It can significantly reduce blood sugar levels over time, which is very important for people with diabetes. It helps lower cholesterol levels and is also linked to reducing proteinuria levels. Now, another food that fights proteinuria due to its anti-inflammatory effects is flaxseed. This tiny seed is also amazing. It protects the kidneys, especially in people with inflammatory kidney disease. Studies show that flaxseed can improve GFR, which is why flaxseed is one of the most recommended foods for people with kidney disease, with or without proteinuria. Just remember that you need to grind flax seeds before consuming or buy flaxseed powder. Alright, I have a special mention when it comes to proteinuria. There's one food linked to reducing proteinuria by up to 36.7%, which is incredible. This is cordyceps, a type of mushroom. I know that cordyceps is often used as a supplement, but you can actually use it to make soup and eat it. However, for most people, supplementing with cordyceps is the more practical way to achieve this result. Alright, let's talk about one of the most underrated complications of CKD, anemia. This is a complication that doctors often overlook. A huge number of CKD patients suffer from this complication, yet many doctors don't pay attention. So many patients are suffering from this issue that some doctors have stopped testing kidney patients for it altogether. They won't even check your iron levels unless you ask. So, make sure you get your iron levels checked if you have CKD. So, what foods are essential for anyone with CKD and anemia? Instead of just listing foods for anemia, I want to share a super easy recipe that is ideal both for health benefits and from a culinary perspective. What I want you to try is a salad made with green beans, kale, and oranges. This may seem like a random combination of foods, but it is not. The reason is the massive amount of iron that kale and green beans can provide. This mineral is key to kidney health and anemia. It is also not easy to obtain in a kidney diet. This is why you must get as much iron from your diet as possible. So, eat all the leafy greens and all the beans you can. Now, most beans also contain protein, but green beans have a lower protein content than any other bean. Green beans also contain carotenoids such as beta-carotene, lutein, and zeaxanthin, which help protect the kidneys from oxidative damage. Kale also has powerful antioxidants like quercetin and camphorol, which can help reduce inflammation. This is why you want these foods on your table every day. Now, remember that you need extra vitamin C for the iron in these foods to be absorbed, and this is where oranges can help. But although this salad is extremely healthy, if you have anemia caused by kidney disease, you will need more than what this salad can provide. You need a diagnosis, proper medical treatment, supplements, and more. Alright, folks, there's another very common complication that you need to take care of with your diet, and I am talking about metabolic acidosis. What is metabolic acidosis, and why should you care about it? This is a complication of CKD that occurs when the kidneys cannot filter enough acid from the blood. This is part of the reason why you should avoid animal-based foods and other foods with a high renal acid load. These foods produce a large amount of acid, and this damages the kidneys as well as other organs in the body. In fact, metabolic acidosis also harms the bones, causing osteoporosis, reducing insulin sensitivity, and even leading to high serum potassium levels. Yes, if you have CKD, a steak is more likely to raise your potassium levels than an avocado. Now, while avoiding animal-based foods, processed foods, and other acid-forming foods such as overly processed grains is crucial for combating metabolic acidosis, you also want to include alkaline foods in your daily diet. Some foods are more alkaline than others, and the most alkaline food you can find is spinach. Yes, this leafy green detoxifies more acid from your body than any other unprocessed food, gram for gram. It is also a major blood pressure lowering food, as we have seen, and it has many other health benefits. There is no reason not to consume it daily. The only issue here is the potassium content, but remember that nowadays, potassium intake in the diet is no longer strictly restricted. Your doctor must determine the real cause of high serum potassium levels if you have this condition, which is often due to blood pressure medications. Another alkaline food is kale. Alright, kale, this is the second time we are mentioning kale in this video about foods you must eat daily. This should really tell you something about the health benefits of this leafy green. Kale is also one of the most alkalizing foods and has a lower potassium content than spinach. The third food here is fennel. This is another fantastic vegetable. People choose fennel for its licorice-like flavor, but it also has impressive health benefits. Fennel can support heart health and cholesterol levels, and also combat inflammation in the body. That is all for today. Thank you for watching, and God bless you all. Goodbye.